Hello and good evening, everyone. So, how are you guys doing today? Yes. Okay, yes. I hope all of you are fine and doing well. Now, welcome to another live session on Eat and Do. Today's live session is exclusively for our NEET MDS aspirants, especially for the 2027 batch. Okay. We had already started learning microbiology and we had already completed one live session of microbiology where we had discussed in detail about the topics related to general microbiology and immunology. We had discussed in detail about sterilization and disinfection, the hypersensitivity reactions, the different types of immunity, vaccines, and everything. Okay, and the MCQs also related to that. Okay, so in today's live session, we'll be mainly focusing on bacteriology. Okay, so if you look at the microbiology textbook itself, you can see that this bacteriology forms the major part of microbiology. Okay, do we have to study all the bacteria? No, we should only focus on the important ones and the high yield ones. Okay, related to the NEET MDS exam. Okay, so first I will tell you like which are all the bacteria that you must give importance for studying for NEET MDS exam, and then we will discuss in detail about all these important bacteria, and then towards the end we will go on to MCQ discussion. All right. Okay. Yes. So, what I had like shown in the previous session is the short chapters and the core sport chapters in general microbiology. Okay. Now these are the short chapters and the core sport topics for bacteriology alone. Okay. So, which are bacteria that you must focus on? Definitely the Staphylococcus and Streptococcus. Mycobacterium TB is like a favorite of examiners, actinomycetes and Clostridia and Corynebacterium. Okay. And sometimes, yes, questions can be asked related to Vibrio cholerae and spirochetes like the Treponema pallidum also. Okay. So these are the important ones. Please do not skip these topics at all. All right. Now, let's start with the basics. That is the bacterial cell. Okay, how a bacterial cell looks like. Okay, so a bacterial cell will have a cell envelope. Okay, so this cell envelope will be formed by majorly two components. Okay, one is the cell wall. Okay, so this is the cell wall, and the other one is the cytoplasmic membrane. Okay, so the outer membrane or the cytoplasmic membrane will be there. Yes. Yeah. Okay. So these two are the major constituents of the uh, bacterial cell envelope. Okay. Now, around this bacterial cell wall, sometimes you will be able to see like a very thin slime-like or viscid layer will be seen. Okay. So that layer is called as the capsule. Okay. Now, under this cell wall, you'll be able to see a plasma membrane and which contains the cytoplasm and the all the organelles. Okay, cell organelles will be present inside this cytoplasm, like the lysosomes will be there, ribosomes will be there, and the chromosomal DNAs and the fat globules, all the inclusion bodies, and everything will be seen inside this bacterial cell. Okay, so this is the structure of the basic structure of an ideal bacterial cell. And sometimes there will be like, if it is a motile bacteria, then there will be organs of locomotion like the flagellum, and there will be organs of adhesion also present. Okay, if the bacteria wants to get adhered or like get attached to one surface, then there will be organs of adhesion also present, which is called as the pili or the fimbriae. Okay, so this is the basic structure of a bacterial cell. Now, there are so many methods for classification of bacteria based upon its oxygen requirements, based upon its size, shape, and based upon the so many biochemical tests and all. There are like so many ways by which we can classify bacteria. Okay, and one way by which we can classify bacteria is based upon its staining characteristics. Okay, especially how the bacteria takes up the gram stain. Okay, so based upon that, the bacteria can be broadly classified into two types. We have gram positive bacteria and gram negative bacteria. Okay, look at any introduction of the bacteria and first line will be like it is a gram positive or gram negative bacteria. Okay, because that's the major staining characteristic that we use for dividing the bacteria. Okay, so what are these gram positive bacteria and what are these gram negative bacteria? Why are they called as gram positive and why some are called as gram negative? Okay, so this gram staining was initially proposed by Christian Gram in some 1880s, and what he did was he used two stains. Okay, there is a primary stain and there is a secondary stain. Okay, so this primary stain will be usually bluish or violet in color, like crystal violet or methyl violet or gentian violet, like those stains are used. Okay, so to a culture or to a smear, first give the primary stain, that is the crystal violet or methyl violet. Give the blue stain first. Okay, then add iodine. Okay, after adding iodine, then decolorize it. Okay, how we can decolorize it? We can decolorize it with the help of acetone. Okay, now after decolorizing the stain, wash it and counter stain. Okay, counter stain means add a secondary stain. Add a secondary stain which is like very much in contrast to the primary color. Okay, so we used blue color first. So now we are using red color. Okay, very much in contrast. Okay, so counter staining with a contrast color, we can use like carbon-fuchsin or methyl red. Such stains are used. Okay, so first primary stain, which is usually blue or violet in color, then add iodine, then add acetone. Acetone is the decolorizer. Decolorizer means whatever stain we had added till now, it will try to decolorize everything. Okay, it will try to remove all those colors. Okay, so that is what the acetone does. Then we add the second stain. Second stain is the counter stain, which is the red color. Okay, methyl red or safranin or stains like that will be added. Okay, and then we will look at that particular slide under the microscope. Okay, after looking at it under the microscope, if the organism still appears bluish or dark blue in color, then such organisms are considered as gram positive microorganisms. Okay, because why they are called as gram positive microorganisms? Because the primary stain, even after adding a decolorizer like acetone, still that dye is retained by that microorganism. Okay, by that bacteria. Okay, so that's why they are called as gram positive microorganisms. Okay, then gram negative microorganisms, after adding the acetone, that whole dye is washed away and it only took up the second stain that we added. That is the methyl red. Okay, so it will be appearing more reddish or pinkish in color. Okay, so such organisms are classified under this gram negative bacteria. Okay, so I think you got the difference between this gram positive and gram negative bacteria. Gram positive bacteria, it will under the microscope, it will still appear bluish or violet in color. Why bluish? Because it resists that decolorization. Okay, and it retained the primary dye itself. Okay, so that's why it's called as gram positive organism. Then gram negative, it completely washes out the primary stain, and whatever the secondary stain we added, it showed that color. Okay, that is the pinkish or reddish color. Okay, so that is why it's called as gram negative organism. Now, why some bacteria are gram positive in nature, why the others are gram negative in nature? That's because of this layer in the cell wall. Okay, this layer is called as the peptidoglycan layer. Okay, see how much thick it is in the gram-positive bacteria. This peptidoglycan layer, it is so thick. Okay, because of this thick peptidoglycan layer only, these bacteria, they retain the diiodine complex. Okay, they just retain the diiodine complex and appear bluish in color. Okay, whereas look at this peptidoglycan layer in the gram-negative organism, very thin. Okay, very thin only. Okay, so they cannot retain that primary di and iodine complex. Okay, so the acetone can easily wash away that complex. Okay, so that's why it appears gram-negative. Okay, pinkish in color. So that's why they are called as gram-negative bacteria. Okay, so this is the major difference between gram-positive and gram-negative bacteria, and why one is appearing like bluish in color and the other one is appearing like reddish in color. Okay, and the main reason for that is this peptidoglycan layer. Okay, so this is the major difference between the gram-positive and gram-negative bacteria in relation to the cell wall components. The peptidoglycan layer thickness will be, it will be very thick for those gram-positive bacteria, and all the other things like the amino acids and the lipopolysaccharides, those will be absent. Only teichoic acid will be present. Okay, only teichoic acid will be present, whether it will be absent in case of gram-negative bacteria. Okay, so this peptidoglycan layer is what is contributing to the uh, gram positiveness of the bacteria. Okay, so this is how the gram positive bacteria will appear under the microscope. You see this bluish color. Yes, this is how it will appear. Whereas look at the gram-negative bacteria, it will appear like pinkish to reddish in color. Now, which all bacteria are gram-positive? Almost all the bacteria that we study, like the streptococci, staphylococci, actinomyces, clostridium, mycobacterium, conibacterium, are all gram-positive organisms. Now, which are gram-negative? E. coli, Salmonella, Helicobacter pylori, Neisseria gonorrhea, all are gram-negative organisms. Okay, so I think now you got an idea between this gram-positive and gram-negative bacteria. This is the basics. Okay, this is the basics of bacteriology and this is the basics of microbiology. Please do not get confused. Next, coming to biochemical test. Okay, so we can do many biochemical tests to differentiate between different types of bacteria. We can do tests like catalase test, coagulase test, indole test, methyl red test, and urease test. There are so many tests that is used to differentiate between the bacteria. Okay, these are the simple tests that we can do in laboratory to differentiate between different types of bacteria. Okay, gene sequencing and all are like advanced methods of differentiating different types of bacteria. But here, these are just simple laboratory tests. Okay, so one such simple but important one is this catalase test. Okay, so in this catalase test, it can be of two types. Okay, we can do it in a slide like this, or we can do it in a tube also. Okay, so this catalase test can be a slide test or a tube test. Okay, so what we are actually doing in this test is take the test sample that we want to check and place it in a slide or place it in the test tube and then add hydrogen peroxide solution. Okay. Once you add hydrogen peroxide solution, just wait. Okay. And after some time, if you are able to see effervescence like this, okay, you see this bubbles that are forming or effervescence like this, then that means that there is a catalase positive organism that is present in the sample. Okay, so it shows that there is a catalase positive organism that is present in the sample. If there is no effervescence like this, then that shows that there is no catalase positive organism. Okay, so why this effervescence is producing? Because hydrogen peroxide, if in the presence of the catalase enzyme, it will get divided into water and oxygen. Okay, so this oxygen is the one that is producing this effervescence, or the oxygen is the one that is producing this bubbles in the reaction. Okay, so that's why it is present. Okay, so it is a very simple test, and this simple test is mainly used to differentiate between Staphylococcus and Streptococcus species. Okay, why? Because Staphylococcus is Staphylococcus aureus. Okay, mainly Staphylococcus aureus and epidermidis, they are catalase positive organism. Okay, whereas Streptococci, they are catalase negative organism. Okay, so this test is mainly used to differentiate between staph species and the strep species. Okay, staph will be positive, strep will be negative for catalase. Okay, so, and there are other organisms also. Okay, you can remember it with this mnemonic, cat in lemon space. Okay, catalase positive, Listeria, Mycobacteria, Nocardia, Staph, Pseudomonas, Aspergillus, Candida, and E. coli. Okay, so remember the cat positive organisms with the mnemonic cat in lemon space. Okay, Streptococci is catalase negative organism. Okay, so this test was like mainly used to differentiate between staph and strep. Okay, very easy laboratory test. Now, these bacteria, okay, whether they are like gram-positive bacteria or gram-negative bacteria, they release toxins. Okay, so these toxins can be categorized majorly into two groups. We have endotoxins and exotoxins. Exotoxins are the proteins, okay, but they are heat labile. Okay, they can get easily inactivated with the help of heat, but and they are actively secreted by these bacterial cells also. Okay, the major thing about this exotoxins is that it has like very high potency and its action is specific also. Okay, for example, like for the tetanus toxin, we know that it is going to affect only the nervous system. Okay, like that, the toxin is very specific and the potency is also very high for these exotoxins. Okay, most of this gram positive and some of the gram negative bacteria secrete this exotoxins only. Whereas endotoxins are, they are heat stable, they are like lipopolysaccharide in nature, but they have non-specific action. Okay, their action is not specific, and they have low potency also. Okay, they are capable of producing fever, but they have like low potency, and such endotoxins are mainly released by the gram-negative bacteria. Okay, so this is the major difference between exotoxins and endotoxins. Okay, the one that is specific and the one that has high potency is exotoxins only. All right. Yes. Now, going to bacterias one by one. Let's start with Staphylococcus aureus. So Staphylococcus aureus, it is, look at it under the microscope and you will be easily recognize it. It will form a grape-like cluster like this. Okay, it's a cocci. Okay, just like the name suggests, Staphylococcus. Okay, cocci means like round. Okay, or and it is non-motile, non-sporing also, and it forms like a grape-like clusters like this under the microscope. Okay, they are gram-positive. Now, which all media that you can use for growing this Staphylococcus? You can use the nutrient agar, where you'll be able to see golden yellow colonies like this. Okay, in McConkey agar, it will produce pinkish colonies. Then in nutrient agar slope also, you will be able to see oil paint appearance like this will be seen. Okay, so nutrient agar slope, and the McConkey media. These three media you can use for growing Staphylococcus. Sometimes they may not ask the cultural characteristics as such, because not making it that tough for the NEET MDS exam, but Yes, you can expect questions like this, which is the selective media for this particular bacteria. Okay, you can expect questions like this. Then there will be like particular characteristics in the culture media, like some will produce like medusa head colonies or golden yellow colonies or thumbprint appearance in culture media. Which bacteria is showing that? Like that also they can ask. So you must be prepared for such special features also. Okay, some special features will be shown by some particular bacteria. Please note down that in a separate notebook and just go through that once in a while. All right. Now, the selective media that is used for the Staph aureus is salt milk agar and salt broth and the Ludlam's media. Okay, biochemical reactions we had already discussed. That it will be catalase positive. It will always also be coagulase positive. Now, there are coagulase negative streptococci also. Okay, so which are the coagulase negative streptococci? Staph epidermidis, Staph hemolyticus, and Staph lugdunensis. Okay, so these are the coagulase negative streptococci, and among that, this staph epidermidis is really important because it is the one that is responsible for causing this stitch abscess. It is the one that has the ability to grow on this artificial heart walls or the prosthetic heart walls on the shunts like that, and on the prosthetic appliances mainly. Okay, this has the ability to grow in this prosthetic appliances. And sometimes this infective endocarditis in drug addicts, yes, that can also be caused by this staph epidermidis. All right. So what are the infections that are caused by the staphylococcus? There are mainly two types of infection. It can either cause infections as such or intoxication. Okay, so infections can be, the most common is the skin and soft tissue infection. All the folliculitis, furuncle, abscess, cellulitis, or the not cellulitis, the carbuncle, impetigo are all caused by this staphylococcus only. Then musculoskeletal disorders like the arthritis, osteomyelitis, bursitis are all caused by staph, and the respiratory infections like the tonsillitis, pharyngitis, sinusitis, and the CNS infections like the meningitis, thrombophlebitis, endovascular infections like the bacteremia, septicemia, pyemia, and the urinary tract infections. Okay, urinary tract infections are mainly caused by the staph saprophytes. All right. These are all about the infections. Now coming to toxin mediated diseases, mainly food poisoning. Okay, the food poisoning is very important because it shows like an acute type of food poisoning. Okay, within 1 hour. Okay, within 1 hour, you can see the symptoms of this staph food poisoning. Okay, it is that quick in nature. Okay. Then other than that, the toxic shock syndrome and scalded skin syndrome also. Okay, so these are some of the toxin mediated diseases that are shown by this staphylococcus. Now, which toxins are responsible for causing these diseases? There are so many toxins like the cytolytic toxins. Okay, all the skin infections are mainly caused by the cytolytic toxins only. The important cytolytic toxin is this alpha hemolysin. Okay, alpha is the one that is mainly causing almost all the infections. Now, other than that, there is enterotoxin. Enterotoxin is the one that is responsible for food poisoning. Okay, this is it is very commonly seen in like meat and fish and milk products, and it resists heating. Okay, it is heat stable. It can be stable up to 100 degrees Celsius for 30 minutes. Okay, it will not be destroyed even at 100 degrees Celsius for 30 minutes. It will not get destroyed, and it usually survives all the normal cooking temperatures also. Okay, that's how it is causing food poison. All right. Now, toxic shock syndrome toxin that is responsible for the toxic shock syndrome, and exfoliative or epidermolytic toxin is also there, which is responsible for the staphylococcal skin scalded syndrome. Okay, SSS. Okay. Then Among the cytolytic toxin, there is a particular toxin that is called as the Pantone Valentine leucocidin. Okay, so this Pantone Valentine leucocidin is important because it is the one that is mostly seen in methicillin resistant Staphylococcus aureus. Okay, especially the community acquired methicillin resistant Staph aureus. Okay, this type of toxin is usually seen. Okay, so if a question on which type of toxin is most commonly seen in the methicillin resistant type of Staph aureus, then it is not the usual ones, alpha, beta, gamma, or delta. It is the Pantone Valentine leucocidin toxin that is most commonly seen. Okay. Enterotoxin for the food poisoning, toxic shock syndrome, TSST toxin itself, then exfoliative or epidemiologic toxin for the Staphylococcus skin scalded syndrome. Now, the Staphylococcus aureus is the bacteria that shows resistance. Okay, so how it shows the resistance to drugs? There are two methods or two mediums by which the Staphylococcus usually shows resistance. One is the beta-lactamase mediated method, and other one is the altered target size PBP2A. Okay, so beta-lactamase mediated means this bacteria, this genetically modified bacteria, it itself produces an enzyme that is called as the beta-lactamase or penicillinase. Okay, so this penicillinase, it will go and activate the penicillin by splitting the beta-lactam ring. Okay, so whatever antibiotic that we are taking, you are normally taking the penicillin groups. Okay, so this bacteria will directly go and destroy that beta-lactam ring. Okay, so there will be no effect of that drug to this MRSA. Okay, the resistant strain, there will be no effect of that particular drug. Okay, so that is the first method. That is the beta-lactamase mediated method. Okay, then there is another method by which these bacteria can show resistance to the penicillins. That is by altered target size PBT2. Okay, so that is by changing the binding protein site. Okay, so when they change the binding protein site, again, it reduces the affinity of this beta-lactam drugs. Okay, so that will result in like resistance to almost all the uh, penicillin groups, like the methicillin or penicillins or other groups also. Okay, it will be resistant to almost all the penicillin groups. Okay, so such bacteria are called as the methicillin resistant Staph aureus. Okay, so this methicillin resistant Staph aureus can again be of two types. We have hospital acquired MRSA and community acquired MRSA. Okay, so this hospital acquired MRSA and in community acquired MRSA, the main mutation was happening in these MEC genes. Okay, this is important. The main mutation due to which this changes are happening or the bacteria is getting resistant to the penicillin therapy is because of this mutation in this MEC genes, MEC genes. Okay. And in addition to the methicillin resistant Staph aureus, there is another new variant that is very commonly seen nowadays. That is the vancomycin resistant Staph aureus. Okay, because for this methicillin resistant Staph aureus, the drug of choice was vancomycin. Now, even for vancomycin, it has started showing resistance. Okay. Yes. So that's about Staphylococcus. Now we are moving on to Streptococcus. Okay, Streptococcus, the appearance will be like very much similar to Staphylococcus, but it will be in chains. Okay, just like we wear the blue beaded necklace like this. Okay, just like this blue beaded necklace, this Streptococcus will be appearing under the microscope. You will be seeing like uh, Streptococcus was in grape-like clusters. Okay, whereas the Streptococcus, it will be like in twisted or coiled long chains like this. Okay, just like the blue beaded necklace like this. Yes, that's how the Streptococcus will appear. Now, there are so many classifications for this Streptococcus, but the one that is like very commonly used is this classification that was proposed by Brown et al. Okay, he studied the behavior of this streptococci in 5% blood agar. Okay, in 5% host blood agar, he studied how this streptococci is behaving. Okay, so when he cultured these almost all the species of streptococci in the host blood agar, he was able to recognize three types of streptococci. Okay, the first one is the alpha hemolytic streptococci. Okay, alpha hemolytic streptococci, it produce greenish discoloration like this. Okay, greenish discoloration indicates that only partial hemolysis had happened. Okay, these streptococci that are growing in this blood agar, it is not able to like completely destroy the RBCs. Okay, it was only able to partially hemolyze. Okay, so that's why it's producing that greenish color. Okay, so such streptococci are called as the alpha hemolytic streptococci. Now, there are streptococci which are like able to completely destroy all the RBCs. They are called as the beta hemolytic streptococci. Okay, they produced colorless colonies like this. Okay, complete hemolysis had happened, so they produce colorless colonies like this. Then there is like gamma hemolytic streptococci also, which do not do any hemolysis. Okay, no hemolysis had happened, so it appears reddish in color itself. Okay, so that is called as the gamma hemolytic streptococci. Now, this is the one of the major classification of streptococci. How streptococcus can be classified based upon the its action in the host blood agar. Alpha hemolytic streptococci, partial hemolysis, beta hemolytic, complete hemolysis, gamma hemolytic, no hemolysis at all. Okay, so this alpha hemolytic streptococcus, it is the group where the major ones like the Streptococcus viridans, Streptococcus pneumoniae, and are all there. Beta hemolytic is the Pyogenes and Agalactiae group are there, and gamma hemolytic, it is the Enterococcus faecalis. Okay, so these are some of the example of the different types of streptococci and the organisms that are present in each group. All right. Now, coming to another classification of streptococcus, that is based upon the nature of the carbohydrate antigen that is present in the cell wall. Okay, so based upon the carbohydrate antigen that is present in the cell wall of the streptococci bacteria, Lancefield, okay, Lancefield grouping. Okay, so this Lancefield had divided the streptococci into 20 groups. Okay, one from A to H and other from K to V. Okay, there is no I and J. There is only A to H and K to V. Okay, so this is the Lancefield grouping. Now, this Lancefield group A is again divided into like different types with the help of Griffith typing. Okay, just know that Lancefield has divided into 20 groups. There is no I and J in it. Okay, how he had classified this streptococci into different groups based upon the carbohydrate antigen that is present on the cell wall. All right. Then based upon the oxygen requirement also it is divided like facultative anaerobes and obligate anaerobes based upon the biochemical test also viridin streptococci. Okay, mutants is the important one that is present in the viridin streptococci group. Now, these are some of the medically important streptococci and the disease it causes. Okay, pyogenes, it causes all the upper respiratory tract infections like tonsillitis, pharyngitis, rheumatic fever, glomerulonephritis, all is caused by the Streptococcus pyogenes. Agalactiae is responsible for meningitis, those kinds of infection. Equisimilis is there, again pharyngitis and endocarditis. Anginosus for pyogenic infections. Faecalis is the one that is mostly responsible for the urinary tract infection. Bovis can cause endocarditis. And the viridin streptococci. Viridin streptococci mainly the mutants type, like the dental caries. Okay, important one for the dentist. Okay, and endocarditis also, sanguis type. Now, how these streptococci is causing these diseases with the help of toxins, mainly the hemolysins. Hemolysins, there are two types, streptolysin O and streptolysin S. O is oxygen labile and S is oxygen stable. Okay. And there is the streptococcal pyrogenic exotoxin also. This is very important. This is another important streptococcal toxin that is responsible for all the typical features that we see in the streptococcal infections. Okay. Other than that, the various enzyme like streptokinase, deoxyribonucleases, hyaluronidase, all those enzymes are also released by the streptococcal species. Now let's have a look at what are all the diseases that are caused by the streptococcus. It can cause suppurative diseases and non-suppurative diseases. Suppurative diseases means the diseases in which there is pus formed. Okay, so such diseases are called as the suppurative diseases. It includes all the respiratory infection and the skin infections like the tonsillitis, pharyngitis, the cellulitis, erysipelas, uh, the necrotizing fasciitis, toxic shock syndrome, genital infections are all examples of this suppurative diseases. Now, other than that, there are non-suppurative diseases are also caused by this Streptococcus pyogenes, which is this acute rheumatic fever and post-streptococcal glomerulonephritis. Okay, this is important because there are only two non-suppurative diseases that are majorly caused by the Streptococcus pyogenes. One is this acute rheumatic fever, and the other one is post-streptococcal glomerulonephritis. Okay, so what is this acute rheumatic fever? The person is already affected with the streptococcus infection. 3 to 4 weeks after this streptococcal infection, what happens is that there will be like inflammation of the cardiac layers, carditis will be there, connective tissue degeneration of the heart walls will be there, inflammatory myocardial lesions. Okay, there will be like inflammatory lesions that you will be seeing in the rheumatic fever that is called as the Ascough nodules. Okay, so this Ascough nodules is like the pathognomic feature of this acute rheumatic fever. Okay, and it is actually a result of hypersensitivity reaction. Okay, so all these will be seen and the patient will be diagnosed as acute rheumatic fever. Now, similarly, if the patient is affected with the streptococcal infection, and again, like 2 to 3 weeks after this infection had happened, there will be, in some patients, there will be kidney problems also. Okay, there will be rapid deterioration of the kidney function also due to some kind of like a type 3 hypersensitivity reaction. Okay, so that will result in something called as post-streptococcal glomerulonephritis. Okay, so first, it can affect the heart. If it is affecting the heart, it can result in acute rheumatic fever. If it is affecting the kidney, it will result in post-streptococcal glomerulonephritis. Okay, so these are the two non-suppurative streptococcal diseases. Okay, so in detail about both these streptococcal diseases are like mentioned here. And coming to the specimen, we can take it from the throat swab or pus swab or exudates. Okay, based upon whether it is suppurative or non-suppurative like that. Then regarding the, take a smear of that sample and stain it with the gram stain. And if you look at it under the microscope, you'll be able to see gram-positive cocci in usually chains. Okay, can be cultured in blood agar. There will be circular, semi-transparent, with clear areas of hemolysis will be seen, or it can be cultured in liquid media also. Okay, where you'll be seeing granular turbidity will be seen. And the selective media that is used for this streptococci is crystal violet. Okay, and the transport media is Pikes media. Okay, uh, storage medium, yes, you can use the Robertson's cooked meat medium also. Now, how you can check whether the streptococcal infection had already happened or not? You can do the serology test. Okay, so the serology test, there are three types. First is the anti-streptolysin O or the ASO titration test. Okay, so if the ASO titers are greater than 200, then that shows that some prior streptococcal infection had happened in that patient. Okay. And next is this anti-deoxyribonuclease B. Okay, so this anti-DNase B titers are greater than 300, then that shows that again some kind of streptococcal infection had happened for this patient. Then there is a third test that is called as a streptozyme test, and it will be like positive for all the throat infections and the skin infections by streptococcus. All right. Yes. Now, what we had discussed till now is regarding the Streptococcus pyogenes and all are aerobic streptococci. Now, there is a special group of streptococci that is called as the anaerobic streptococci, which mainly includes this peptostreptococcus groups. Okay. So, there are like lots of important varieties of this anaerobic streptococci, which is mainly responsible for brain abscess, lung abscess, and Bartholin's abscess, infected sebaceous cyst, cellulitis, diabetic ulcer, gangrene, and all can be caused with the help of this anaerobic streptococci. All right. Now, there is something called as CAMP test and reverse CAMP test. Okay. So this CAMP test means this CAMP, it actually refers to Christie Atkins Munch Peterson test. Okay. So this CAMP test is actually used to identify group B streptococci. Okay, especially the Streptococcus agalactiae. Okay, so if you, from a culture, if you want to identify the Streptococcus agalactiae species, then you can do this CAMP test. Okay, so how you do this CAMP test? There is a culture medium, and in that there will be first Streptococcus aureus. Okay, Streptococcus aureus will be streaked, and perpendicular to it, you can streak this test medium also. Okay, so if you want to check whether there is group B streptococci that is present in this, then after incubated and after incubation, if you look at it, there will be arrowhead zone of hemolysis like this. Okay, like perpendicular to this staph aureus streak, you will be able to see an area of hemolysis. Okay, so that particular area will be in the shape of like an arrowhead. Okay, so such arrowhead zone of hemolysis will be seen perpendicular to the staph aureus streak. Okay, so if you see this arrowhead, then that means that, okay, there is a group B streptococci, like streptococci agalactiae that is present in this sample. Okay, if there is no group B streptococci, then it will appear something like this. Okay, you see here, no arrowhead hemolysis. Okay, no arrowhead hemolysis means CAMP test is negative. If there is arrowhead hemolysis, then that means that CAMP test is positive. Okay, so this is regarding the CAMP test. Then there is something called as reverse CAMP test also. Where you will use this reverse CAMP test? Reverse CAMP test is used for identifying Clostridium perfringens. Okay, so if you want to know whether a particular sample has Clostridium perfringens, then you do reverse CAMP test. So how you do reverse CAMP test? Instead of staph, here we are using Streptococcus agalactiae. Okay, we are streaking Streptococcus agalactiae, and perpendicular to that, we are streaking the test sample. Okay, so if that particular test sample has Clostridium perfringens in it, it will produce a reverse arrowhead hemolysis. Okay, it is called as reverse arrowhead hemolysis, or it is also called as bow tie hemolysis. Okay, so if you are able to see such a bow tie area of hemolysis, then that means that that particular sample that we are testing, it has Clostridium perfringens in it. Okay, if there is no hemolysis like this, then no Clostridium perfringens. Okay, so remember, CAMP test is for Streptococcus group B streptococci identification. Okay, like Streptococcus agalactiae. Whereas reverse CAMP test is for Clostridium perfringens identification. Okay, so this is the difference between camp and reverse camp. Okay, please do not get confused. This is the basics. Okay, now next bacteria we are going is the Corynebacteria. Okay, so Corynebacteria again gram positive, non-sporing, non-motile, non-capsulated. The main characteristic appearance of this bacteria is that it will have a bacillary body like that, and it will have club shaped swellings like this at the end. Okay, so this club shaped swelling will be somewhat very big than the bacillary body. Okay, so such swellings will be seen in this Corynebacteria. Okay, the important species among this Corynebacteria is this Corynebacteria diphtheria, which causes the disease diphtheria. Okay, so in diphtheria, you will be able to see a pseudomembranous whitish membrane like this in the uh, throat region, which is usually non-scrapable in nature. Okay, if you try to scrape it, there you can see bleeding coming from it. Okay, so that is the Corynebacteria. So corny means club and diphtheria means leather. Okay, since it is the pseudomembrane that it is producing is appearing having a leather-like appearance. That's why it's called as leather-like appearance. Okay, diphtheria. Okay. So it can these Corynebacteria can be grown in Loeffler's serum slope where it will be producing like white or yellow disc-like colonies, or it can be grown in telluride blood agar also. In telluride blood agar, it will be producing gray or black colonies. Okay, so how this Corynebacterian diphtheria is causing this diphtheria disease? It is with the help of a toxin. Okay, it is with the help of the diphtheria toxin. Now, this diphtheria toxin, if you look at the structure of this diphtheria toxin, it has two units. Okay, one is the A fragment and another one is the B fragment. Okay, so this A fragment, it is called as the active domain because it is the one that is responsible for the action. Okay, it is the one that is responsible for causing the disease. That is called as the fragment A. Then there is a fragment B also. This fragment B is the binding domain. Okay, A is active, B is binding. Okay, this B is the binding domain and it will trigger the entry into the cell. Okay, so when there is a cell and if this diphtheria toxin is attacking this particular cell, first the fragment B will act, will go and bind with the cell, then it will release the fragment A, okay, which is the one responsible for all the actions. Okay, so once this toxin is inside the cell, what it does is that it will directly go and inactivate EF2. Okay, EF2 is the elongation factor. Okay, so this elongation factor, if it is getting inactivated, then there will be no protein synthesis that is happening inside the cell. Okay, all the protein synthesis inside the cell is completely inactivated and it causes the disease. Okay, so this is how Corynebacteria, when it attacks the cell, how it acts. Now, there is a special stain that we use for identifying this Corynebacteria, that is this Nisser's or Albert stain. Okay, so when you stain this bacteria with Nisser's or Albert stain, like I had previously mentioned, it will be seen like this. Okay, like bacteria with the at the ends, there will be club-shaped swellings like this. Okay. So these club-shaped swellings, they are formed by metachromatic granules. Okay. They are also called as volatile or Babes Ernst granules. Okay. So these purple colored granules that you see at the end of these clubs, yes, they are the metachromatic granules or the Babes Ernst granules. Okay. And the green colored ones, they are the bacilli. Okay, so this overall arrangement, it is called as the Chinese letter or the cuneiform arrangement. Okay, so under this Nisser's or Albert stain, which is the special stain that we use for diagnosing Corynebacteria, it will be appearing mostly like this Chinese letter or cuneiform arrangement. Now, telluride blood agar is one culture media to which we can grow this Corynebacteria. So based upon its growth in telluride blood agar, there are three types of conibacterial colonies we can identify. Okay, one is the Mitis colonies. Okay, Mitis colonies will produce like a flat, shiny, black colonies like this. Okay, so this is called as the poached egg colonies. Okay, then there is the gravis. Okay, gravis, it will produce a flat colony with a raised dark center and crenated edges. Okay, just like the daisy flower. Okay, so it is also called as the daisy head colonies. Then there is the intermediate type where the colonies will be like dull, granular, with a glistening periphery like that. That is called as the frog's egg colony. Okay, so based upon its growth in the telluride blood agar, there are three types can be noticed. One is the Mitis type, then Gravis type, and intermediate type. Mitis type, it shows the poached egg colonies. Gravis type, it shows the daisy head colonies. And the intermediate type, it shows the frog's egg colonies. Okay, so these are the three types and the types of colonies it shows. There is something called as LX gel precipitation test also. This LX gel precipitation test is used to easily identify this toxigenic strain of Corynebacterium. Okay, so what you can do is that uh, take a sample and a filter paper can be dipped in that sample. Okay, so if this filter paper is placed on a host serum agar and incubate it at 37 degrees Celsius for 1 or 2 days, if you are able to see a precipitation line like this, okay, if you are able to see a precipitation line like this extending from that filter paper, then that means that you have a toxigenic uh, Corynebacterium strain. Okay, if there is no precipitation line like this, then there is no there is no toxic Corynebacterium strain. Okay, so this is one of the simple tests to identify whether there is a toxic Corynebacterium strain is present there or not. Okay, it is called as the LX gel precipitation test. Next is Clostridium. Clostridium, there are different species of Clostridium like the perfringens, tetani, botulinum, and histolyticum, and all these species are capable of producing very medically important diseases like gas gangrene, food poisoning, tetanus, and botulism. Okay, so the most important one is definitely the Clostridium perfringens, which is responsible for causing the gas gangrene. Okay, so it is an anaerobic bacteria which is gram positive, and since it's anaerobic, the media in which it can be grown is Robertson's cooked meat medium, where it will produce like pink to blackish colonies, and litmus milk medium can also be used for its growth. Okay, and the major toxins that are released by this Corynebacterium include alpha, beta, epsilon, and iota. Among this, the alpha is the one that is responsible for this gas gangrene because it is dermatonecrotic in nature, it is hemolytic in nature. Okay, so once this Clostridium is present in the skin, we cannot like suggest that, or we cannot predict that it will go into gas gangrene. Okay, usually some anaerobic cellulitis can happen initially, and when this infection attacks the muscle tissue only, underlying muscle tissue only, then only we will be calling it as gas gangrene. Okay, because when it attacks the muscle tissue only, this anaerobic myositis is happening, and then it is called as gas gangrene. So what all diseases can be caused by this Clostridium? Gas gangrene, food poisoning, gangrenous appendicitis, necrotising, enteritis, brain abscess. These are all caused by this Clostridium perfringens itself. Now, these the bacillary bodies of these bacteria will have spores. Okay, so based upon this arrangement of these spores only, we can identify which species of Clostridium it is. Okay, so if you look at this Clostridium tetani, this Clostridium tetani have like spherical and terminal spores. Okay, that is, if this is the bacterial body and it will have a spherical terminal spore at the end of the body. Okay, so that will give more like a drumstick appearance. Okay, so this drumstick appearance is usually seen from with this Clostridium tetani. Now, if it is Clostridium tertium, it also will have a terminal spore, but here the spore is somewhat oval in nature like this. Okay, so if we are seeing oval spores, then we can predict that it will be Clostridium tertium. Now, in case of Clostridium perfringens, the spores will be somewhat away from the end. Okay, it will be somewhat subterminal in position. Okay, not at the end, just a little bit away from the end. Okay, that is called as the subterminal position. It is usually shown by this Clostridium perfringens. And if it is at the center, okay, if it is right at the center of the bacillary body, then it is called as the Clostridium bifermentans. Okay, so these are the different species of Clostridia and how they appear under the microscope based upon the spore arrangement. All right. Now, regarding the Clostridium perfringens, there is an important test that is used to diagnose whether for the rapid detection of this Clostridium perfringens, we can do a test that is called as the Nagler's reaction. Okay, so in Nagler's reaction, what we are actually doing is that this Clostridium perfringens, it is allowed to grow on a culture medium that contains agar and the Fildes peptic digest of sheep blood and human serum, 20% human serum also. Now, this Clostridium antitoxin is like there must be a test and there must be a control. Okay, so this Clostridium antitoxin is like grown on one side only, and at the other side, negative control is used. Okay, so for the positive, if the Clostridium perfringens is present, then there will be no zone of opacity. Okay, it will be just like this zone. There will be no zone of opacity. But if no Clostridium perfringens is present, then there will be a zone of opacity like this surrounding that particular area. Okay, so if that zone of opacity is present, then there is no presence of Clostridium perfringens. Okay, if there is no zone of opacity, then it shows that there is presence of Clostridium perfringens. Okay, so why no zone is appearing there? Because the zone is like completely neutralized by the alpha toxin that is released by this Clostridium perfringens. Okay, that's why no zone will be present. So for the Corynebacteria, we had the Alex gel precipitation test, and for the Clostridium, we have the Nagler's reaction. Now, the next is the Vibrio cholerae. Vibrio cholerae is like a comma-shaped bacteria. Okay, it is a gram-positive comma-shaped bacteria. Okay, it is a gram-negative. Okay, sorry, it is a gram-negative comma-shaped bacteria, which is motile also. Okay, so since it's because of its motility, Koch had described it as fish in stream appearance. Okay, it is called as fish in stream appearance, and it can be cultured in with the help of nutrient agar or blood agar or McConkey agar. The transport media of this Vibrio cholerae is a different one. Okay, so the transport media for this Vibrio cholerae is Venkatraman Ramakrishnan medium and Carrie Blair medium. Okay, it has high amounts of crude salt in it. Okay, so that's why special transport media like this Venkatraman Ramakrishnan medium and Carrie Blair medium is used. Okay, and there is a simple way to demonstrate Vibrio cholerae in a test sample. The test sample that needs to be tested can be taken and it will be mixed with 0.5% sodium deoxycholate in saline. Okay, so if you mix the test sample, take a slide, keep the test sample and mix it with 0.5% sodium deoxycholate in saline. Okay, then mix it properly and take a loop and uh, try to stick the loop in that particular specimen and try to take it away from that specimen. Okay, so while taking the loop away from the specimen, if you are able to see a string like this, okay, if you are able to see a string like this, then that means that Vibrio cholerae is present in this particular specimen. Okay, if no string is present, no Vibrio cholerae. Okay, so this is the string test for Vibrio cholerae. Okay, if the uh, string is there, if it is showing a positive string test, then that means that Vibrio cholerae is there. If there is no string, no Vibrio cholerae. All right, then there is something called as cholera red reaction also. Cholera red reaction means this Vibrio cholerae, it will show positive properties to indole. Okay, indole test will be positive and nitrite test will also be positive. Okay, so if you are adding uh, sulfuric acid to 24-hour peptone water culture, then this Vibrio cholerae, uh, they will be able to show a reddish pink color like this. Okay, this reddish pink color is formed in the sample that is infected with Vibrio cholerae. Okay, so that is because of the formation of this nitroso-indole. Okay, because it will be positive for indole test and it will be positive for nitrate test also. Okay, so it will show a positive reddish pink color like this, which is called as the cholera red reaction. Okay, so it is called as the cholera red reaction. Now, next is mycobacteria. Mycobacteria is the important one that is responsible for causing tuberculosis and leprosy. And this mycobacteria, just like the name suggests, mycobacteria. That means that it is like a fungus-like bacteria. Okay, may resemble like a fungus, but it is not a fungus. It is a bacteria only. And its main properties is that it is an acid-fast bacilli. Okay, acid-fast bacilli means it resists the decolorization. Okay, so it is also considered as an alcohol-fast bacilli also. That is, it resists the decolorization with 95% alcohol also. Okay, so why it is resisting this decolorization is because of the presence of this mycolic acid in the cell wall. Okay, so the cell wall of this mycobacteria, it contains mycolic acid. Now, because of the presence of this mycolic acid, it is an acid-fast bacilli and an alcohol-fast bacilli also. Okay, it is slow-growing aerobic. Okay, like it can be considered as an obligate aerobe. Okay, if the oxygen is not there, then these organisms can get destroyed. Okay, aerobic, non-motile, non-capsulated, and non-sporing in nature. Now, which is the stain that can be used for identifying this mycobacteria? One is Zeal-Nielsen staining, and you can also use fluorescent stains like the Oramine or rhodamine. Okay, so under Zeal-Nielsen staining, the organism will appear pinkish red color like this against a blue background. Okay, it will be very easy to identify the mycobacterium under this Zeal-Nielsen staining itself. Then the medium, the special medium that is used for growing this Mycobacterium tuberculosis is Lowenstein-Jensen medium. Okay, can also be grown in the Loeffler's job, but mainly it is the Lowenstein-Jensen medium. The solid medium is the Lowenstein-Jensen medium. The liquid medium is the Dubose medium or the Middlebrooks medium. Okay, now other than these like classic mediums, there are newer methods also for the growing Mycobacterium tuberculosis, like the Bactec 460 or the Bacti Alert or the Bactec MGIT, like that. New automated culture methods are also there. Now coming to actinomyces. Okay, actinomyces, which is responsible for causing actinomycosis. Okay, it contains different species like Actinomyces israeli, Actinomyces bovis, Actinomyces neslendi, Actinomyces viscosus, like that. So many species are there. They are gram-positive, non-motile, non-sporing, and non-capsulated. One characteristic feature of this actinomyces infection is the production of sulfur granules. Okay, so the sulfur granules, you can view it directly under the microscope, or you can shake that. If you take the pus that is formed from this infection, and if you shake that specimen in the test tube with saline, you'll be able to see sulfur granules. Okay, like whitish or yellowish specks, or like very small, okay, very small diameter uh, structures will be seen at the end of this test tube. Okay, they are the sulfur granules. Okay, you can see here whitish or yellowish, very small specks of granules will be seen. Okay, they are called as the sulfur granules. And microscopically, it will be easy to identify those actinomyces. There will be gram-positive filaments, and it will be surrounded by club-shaped structures. Okay, there will be gram-positive filaments, and it will be surrounded by club-shaped filaments like that. Okay, lots of club-shaped filaments like that will be surrounding it. Okay, so overall, it will be producing a sun ray appearance like this. Okay, classical histological feature of actinomyces will be seen. It can be grown in thioglycolate liquid medium also, where it will be able to see fluffy balls like this, or it can be grown in brain heart infusion agar also, where it will be able to see spidery colonies like this. Okay, so thioglycolate liquid medium and brain heart infusion agar both can be used for growing actinomyces. You'll be able to see fluffy balls or spidery colonies. Then there is the Provotella. Okay, so Provotella is another anaerobic gram-negative bacilli. It includes melaninogenica, the Bacillus, the Provotella denticola, Provotella intermedia, the ones that are important in Perio also. Okay, so such species will be there in the Provotella. This Provotella melaninogenica, it will be able to produce like black or brown colored colonies like this. Okay. Now, one characteristic feature of this Provotella melaninogenica is that if we are taking this culture medium and this culture plate and look at it under the UV light. Okay, if you look at it under the UV light, it will produce a brick red fluorescence like this. Okay, so such brick red fluorescence is the characteristic feature of this Provotella melaninogenica. Okay, so this is one of the characteristic feature of Provotella alone. Okay, so I think we had almost discussed almost all the important bacteria till now. Now we are moving on to the questions. Okay, so the component of bacterial cell wall which is responsible for endotoxic activity. Okay, so which component of bacterial cell wall is responsible for endotoxic activity? If you know, you can uh, put your answers in the chat box. Yes, the answer is option A, lipopolysaccharide. Okay, lipopolysaccharides are the ones that are responsible for these lipopolysaccharides. They are the ones that are responsible for the endotoxic activity of the gram-negative cell. Okay, so it has three regions like region 1, region 2, and region 3. And those are mainly responsible for this endotoxic activity of this gram-negative bacteria. Now, next question. A group of people presented to emergency department with complaints of vomiting and diarrhea after consumption of food at a marriage reception. The causative agent of food poisoning with incubation period of 1 to 6 hours is. Okay. Incubation period of 1 to 6 hours means it is like a very quick incubation period and very acute disease. Okay. So Out of these four options that are given here, okay, Staph aureus, Clostridium perfringens, norovirus, and Vibrio parahemolyticus, all are capable of producing food poisoning. But which is the one with such lowest incubation period is option A, Staphylococcus aureus. Okay, so the incubation period of Staph aureus is just 1 to 6 hours, whereas for the Clostridium, it is 8 to 16 hours. Norovirus, it is 12 to 48 hours, and Vibrio parahemolyticus, it is 8 to 48 hours. Okay, so we had already mentioned the enterotoxin that is released by the Staph aureus is responsible for this food poisoning. It is a heat stable protein, a toxin, and it causes like a rapid vomiting. Okay. Now, the diagnostic technique that is shown in the image given below is, okay, it is a diagnostic technique that is used for identifying a spirochete. Okay, like the fluorescent dye is used to identify the motile spirochete. Okay, so among these ones, which is a spirochete, it is option D, syphilis. Okay, for identification of Treponema pallidum. Okay, which is a spirochete, we can use this diagnostic technique, which is a fluorescent dye technique that is used for identifying Treponema pallidum. Now, next, a bacteria gave the following reaction with catalase. Which of the following could it be? Okay, so effervescence. Okay, as you can see in the sample, you will be able to see effervescence. Effervescence means it is a catalase positive reaction. So among the four, which is a catalase positive organism? It is option A, Staphylococcus aureus. Okay, so the answer is Staphylococcus aureus. All the others are catalase negative organisms. In catalase negative test, there will be no effervescence seen. Okay, because no oxygen will be released. All right. So the correct answer is option A, Staphylococcus. You remember this? Yes. Next question. A 25-year-old lady presents to the clinic with chief complaint of painful pimples on the back and scalp region. Sample taken from the site is cultured and deep golden yellow colonies are seen. Gram-positive coagulase and catalase-positive cocci are present in the first sample taken from the pimple. Which of the following may be the causative organism? Okay, so let's look at the key points in the question. Painful pimples, a skin infection, deep golden yellow colonies, where you will see deep golden yellow colonies in the nutrient occur. They are gram positive and coagulase and catalase positive cocci also. Okay, Streptococcus pyogenes is not catalase positive. Okay, so only one is catalase positive, coagulase positive, and produces deep golden yellow colonies, and that is option A, Staphylococcus aureus. Okay, see this deep golden yellow colonies that you see in the nutrient agar? Yes, they are a characteristic feature of Staph aureus. Now, next question. The non-suppurative complication of Streptococcus pyogenes infection is? What is the non-suppurative complication of Strep pyogenes infection? We had seen it is just two non-suppurative complication of Strep pyogenes is there. One is acute rheumatic fever and the other one is post-streptococcal glomerulonephritis. Okay. Yes. Now, which of the following bacteria is more important for producing cellulitis? Okay, so cellulitis is mostly caused by option A, streptococci. Okay, staphylococcus can also contribute to it, but the most common one is that is responsible for causing the cellulitis is group A streptococci, that is the Streptococcus pyogenes. Okay, so cellulitis, as you all know, it is the inflammation of deep dermis and the surrounding subcutaneous tissue. There will be an infection without any abscess or without any pus discharge. Okay, the borders will be like poorly demarcated. You cannot make out the borders. The skin will be warm, and as you can see from this image itself, it will be erythematous in appearance, and there will be tender on palpation, and edema can also be there. It is a case of acute bacterial infection, and the major microorganism that is responsible for it is group A streptococci or and Staphylococcus aureus also. But since they had asked here the major one, we are going with the group A streptococci, that is the Streptococcus pyogenes. Now, next question. The gas gangrene is caused by. This is a NEET MDS 2024 question. Okay, the gas gangrene is caused by, very simple, easy to answer. It is option C, Clostridium. Okay, Clostridium perfringens. That is the one that is responsible for causing this gas gangrene. Okay. Next, identify the Clostridium species based on the spore arrangement in the given figure. Okay, so we had seen based upon the bacillary body and the arrangement of spore in relation to the bacillary body, there are different species of Clostridium. So here, if you look at it, the spores are right at the middle of the bacillary body. Okay, so what is it called? Yes, Dr. Kartika, you are right. It is option D, Clostridium bifermentans. Okay, you remember this figure? Tetani will be round and at the end. Tertium, oval at the end. Perfringens, subterminal, oval. And the one that is at the center is the Clostridium bifermentans. Now, next question. A 6-year-old boy develops a mild fever and sore throat. On general examination, his tonsillar pillars were covered by gray-white discharge, and cervical lymphadenopathy is also noted. Cultured and to detect the microbe, and the following image is obtained. The colony characteristics of the microbe involved are all except. Okay. Let's have a look at the key points. Mild fever and sore throat. Tonsillar pillars covered by gray-white discharge. Okay, classical symptoms of diphtheria. Okay, and cervical lymphadenopathy also. And this is a special stain. Okay, image that is by the Albert stain. Okay, the Nisert stain or the Albert stain had given this image, which shows the Chinese letter arrangement or the cuneiform arrangement with Babe Ernst granules at the ends. Okay, classical example of Conibacterium diphtheria. Now, if you are like culturing this Conibacterium diphtheria under the telluride blood agar, okay, you'll be able to see 3 types of colonies. Okay, now, which is not a characteristic of this colony. Okay, which is not seen is asked. Okay, so yes, Dr. Kartika, you are again right. The frog's egg colonies will be seen. The poached egg colonies will be shown by the meters, and the daisy head colonies will also be seen. Okay, the one that is not seen is medusa head colonies. Okay, so where you will see this medusa head colonies, it is mostly seen in Bacillus anthracis. Okay, in anthrax infection. Okay, there you will be seeing this medusa head colonies. Okay, so the poached egg colony, it will be seen in the metis, daisy head colonies in the gravis type, and the frog's egg colony in the intermediate type. Okay, the one that is not seen is medusa head colonies. Medusa head colonies are a typical feature of Bacillus anthracis. Okay, the one that is causing anthrax infection. Now, identify the type of bacteria shown in the image given below. Pinkish color bacteria, that means it is gram negative. And look at the shape. It is comma shape. Okay, so the comma shaped gram negative bacteria, yes, Dr. Katika, you are again right. It is Vibrio. Okay, it is the Vibrio cholerae species. Staph, it will be grape-like clusters. Streptococcus, it will be like chain in chains. All right. Conibacterium, you know, the typical bodies will be seen. Okay, the granules will be seen. So yes, here it is Vibrio. Okay, fish in stream appearance and the comma-shaped bacteria. Now, next question. The most commonly used selective media for the isolation of Mycobacterium tuberculosis is. which is the selective medium that is used for Mycobacterium tuberculosis. Yes. Again, Dr. Kartika, you are right. It is Lowenstein-Jensen medium. Okay. You see this medium in which the mycobacteria are growing. Yes, this is a typical example of Lowenstein-Jensen medium. Now, next, which of the following bacterial cultures show red fluorescence when exposed to UV light? Yes, it's option C, Provotella melaninogenica. Yes, you see this brick red fluorescence under the UV light. That is a characteristic feature of Provotella melaninogenica. Now, next question. The mechanism of action of diphtheria toxin is by. How does the diphtheria toxin act? Is it by increasing the adenylate cyclase activity, or by blocking the production and release of acetylcholine and neuromuscular junction, or by inactivating elongation factor 2 and causing lysis of erythrocytes? Yes, again, Dr. Kartika, you are right. It is by inactivating elongation factor EF2. Okay, so there are two, like I had already mentioned, two subunits. Fragment A, action. B, binding. It will endocytosis and it will inactivate the EF2. Okay. Yes, so that's all for today. I think like too much bacteriology for today. We had discussed almost all the important bacteria and their important characteristics. Some of the important appearances are really important. Not much frequently asked for the NEET MDS examination, but yes, can be asked. Okay, so if they are like asking about the culture media, selective media that can be used for particular bacteria, then you must know like which one to choose. Okay. So yes, that's all about bacteriology. Yes. If you have any doubts, you can ask now. You can also comment below this video, even if the live is over. Okay, you can also comment below this video, or you can ask the doubt directly to me, or you can put it in the WhatsApp group also. Okay, I will definitely answer all your queries. If you are not remembering, or if you want to go through this topics again, please go through it. And if you're having any doubts, feel free to ask me. All right. So yes, see you next for the virology class. Okay. Yes. Thank you for attending the session. Thank you so much. Goodbye and good night.